Hi everyone, I'm Dr. Angie Nunnery and welcome to Wellness Wednesdays. How are you guys doing tonight? I thank you for being here tonight, and first of all, I would like to apologize for the earlier time. We're starting at 5:30 tonight instead of our usual time of 7:30, but we really want to thank you. Hi Chris, I see Chris is on. Hi Chris, thank you for being here. Tonight we're going to be talking about cancer prevention. Cancer prevention, which is a really neat topic, and I want it to be interactive. So type in your comments and let me know what you guys think. And I want to welcome you and thank you for tonight. So the polling question, I don't know if any of you guys who are watching saw the question that I put out for the polling. And the polling was, what does the National Cancer Institute list as the #1 most preventable cause of cancer? Does anybody out there know? Did anybody answer in the Facebook post? Maybe. Okay. Well, it is cigarette smoking, tobacco use in general. The National Cancer Institute states that more than 180,000 Americans have passed away in the year 2014 of cancer related to tobacco use. So one of the cool things that I wanted to talk about is that your primary care physician can help you. Hi everybody, lots of people texting in. Thank you guys. Welcome to tonight's Wellness Wednesdays. Tobacco use is the #1 most preventable cause of cancer, and your primary care physician can help you. And one of the cool things is that I'm one of the 58 partners with Click It Clinic, which is our telemedicine practice, and tobacco use and tobacco cessation treatment can be treated online via telemedicine. So if you have any questions that you feel like tonight that you want to ask about cancer prevention and specifically about smoking cessation, can you give us a call? Dial our 800 number is listed in the bio, and we will be glad to set up an appointment with you and help you with tobacco cessation. Now, one of the other there's a question. When you say tobacco use, is that the same thing as dipping for a man? Yes. Chewing tobacco is a cancer-causing agent, and in fact, the most common cancers, I guess, you all hear about smoking causing lung cancer, but did you know that smoking is related to other cancers such as oral cancer, gastric cancer, which is stomach cancer, and chewing tobacco is actually related to, has been linked to oral cancers. So all tobacco use has some type of link to cancer. So yes, all tobacco use. And then Chris says, that was Chris's question. So that's excellent. There are a number of other cancers that some people may not know can be linked to smoking, including bladder cancer, and any type of sometimes there are some links that state that tobacco use, of course, is related to lung cancer. Believe it or not, the one that I thought was very difficult to imagine, but it's true, is that there are some studies out that state that tobacco use is linked to cervical cancer. Now that's incredible. So one of the things is that we're going to talk about tonight is healthy habits, and as some of my childhood friends say that I've said since childhood, you only get one body, and it's our body for life. So we got to take care of our bodies the best way that we can. Now, one other really powerful statement that the National Cancer Institute has stated is that between 50 and 75% of all cancers could be prevented by changing 3 basic things in our lifestyle, and that is 1, tobacco use. Believe it or not. 2, if we exercise more and have a less sedentary lifestyle. And number 3, changing our eating habits. If we change those 3 things, 50 to 75% of all cancers could be prevented. That's very, very powerful. And it kind of goes back to, I guess, the way that many of us were raised as kids. You know, the generations before us lived off the farm. They ate lean meats. They ate whole grains. They grilled and broiled food more than frying the food. And so they had a healthier lifestyle. And we're seeing a transition. Those of us in primary care, we're diagnosing more and more patients with cancer in our offices. And some of it has to do with many of the environmental factors. So what do you do about this? And hi, Dr. Nix is chiming in. Hi, guys. Hi, Dr. Sharp coming in. One of the things is that poor diet and lack of exercise also leads to an unhealthy weight. And one of the things is that we talked about a couple of weeks ago on looking at ways that we can become more fit. And the most common cancers that are linked to obesity, believe it or not, are colorectal cancer, esophageal cancer, kidney cancer. And we had one of our kidney experts on about 3 weeks ago talking about keeping your kidneys healthy, and that was an awesome talk. Pancreatic, prostate cancer, and breast cancer after menopause. All of these cancers have been linked to unhealthy habits with not keeping proper diet and proper balance of exercise. So one of the big questions that my patients ask me daily is, what do I eat that's healthy? And how do I have enough time to exercise? Many of you guys that are out there watching this post tonight are just as busy as I am. It is very tough. One of the examples that I gave my patient today was, it took me, I'm about 15 minutes from the gym, and it took me about an hour and 15 minutes to get from my office to the gym yesterday. And it wasn't because of traffic. It was because of, I'm a mom, I'm a wife, I'm a doctor on call. I'm running my own business. So I had so many different phone calls, blocks, stops, and distractions to me doing the one thing that I wanted to do, and that was take care of myself and just get to the gym. And that happens to all of us. And so I tell patients, we have to talk to ourselves. And it sounds crazy to talk to yourself, but we really do have to talk to ourselves over and over and say, I'm going to do this, I'm going to hit my goal. Because at the end of the day, we feel better, right? You feel better after you've exercised. And if you're multitasking and doing a lot of things, especially, and I know I'm a little bit biased, but especially if you're a working mom, we need a little bit of downtime. We need a little bit of peace in our day and a little bit of peace in our life to recharge, regroup, and get to the next job that we're going to do after we're on the treadmill for about 45 minutes, or the elliptical, or walking 15 minutes away from home and 15 minutes back. And guess what? You're burning a lot of calories. You know, it's not just feeling better and peacetime. You're actually doing something that's going to be healthy. And the amount of exercise, the amount of cardio workout that you put on your heart is healthy. It's just kind of like you see the bodybuilders building their muscles and exercising to build up muscle. We're building and strengthening the muscles of our heart when we're exercising. So the foods, lean meats, whole grains, grilling instead of frying. The exercise, 30 minutes a day, 5 days a week, walking 15 minutes away from home, 15 minutes back, that's 30 minutes. You don't have to spend a lot of money. You don't have to buy a health club membership. I'm a cheapo. I go to the YMCA because I can get me and my 3 kids and a husband, and I can put grandmother on the plan, and she can go to senior exercise. We can do all that for the same one monthly cost. So it doesn't have to be expensive, and it's very, very rewarding. I see a couple of questions that say, oh, thank you guys. You guys are saying you appreciate it. Thank you guys so much. I appreciate you guys. Now, one of the most powerful messages that I've heard from the National Cancer Institute, and I'm going to read this verbatim. They state that all cancer deaths caused by the heavy use of alcohol could be prevented completely. Now, all cancer deaths could be prevented completely with the cessation of alcohol. So that's number 4. Now, this is a totally different statement than what we talked about above. We talked about proper diet. We talked about keeping an exercise program. We talked about smoking cessation. The American Cancer Society is also saying that heavy use of alcohol can lead to detrimental cancers. That's pretty powerful if they're talking about cancer prevention, and that those types of cancers can be totally eliminated. Now, what types of cancers can be linked to that? Of course, liver cancer is one of the biggest ones that is linked to heavy alcohol use. And kind of what I tell patients is, when you think about healthy eating habits and what types of cancers those are linked to, think about what you're putting in your body and where is it going. It's going from your mouth to your esophagus, down into your stomach, through your colon. So if you're putting if you're putting caustic things, or you're putting things that you kind of think might be unhealthy, or the amounts might be unhealthy, those are kind of the organs that this is affecting. And someone with Click It Clinic is asking an excellent question. I asked that question too, and I could not find the answer to that question, and that is, what is heavy alcohol use? And that is a very good question. I tried to research it and could not find a really good answer for what heavy use is, because that is kind of a value kind of judgment. We know that drinking a little bit of wine with your evening meal, and red wine has been shown to be heart healthy, and so, but the American Cancer Society doesn't tell us where the line is drawn and where we're going to get to an unhealthy amount. But that's an excellent question. I asked the same thing. One of the other types of cancers that's been linked to environmental factors is melanoma. Melanoma is a deadly type of skin cancer, and it's been linked to UV radiation, which is ultraviolet radiation, and that's tanning in the sun. But believe it or not, that's also tanning in the tanning beds. And so one of the questions I got last week from a patient was, why is this in the tanning bed? How can that hurt me? And one of the best ways that I can describe that is that when you're tanning, you're killing some of the cells in your skin. They kind of go into shock, and when they go into shock, our natural body's reaction is to try to rejuvenate and remake those cells. And sometimes the rejuvenation process kind of goes off kilter, and so while your body is trying to make new cells, sometimes an abnormal cell is made in that process, and it goes down the wrong road into a cancer cell. Now, we've got a question from Jenna Brock Welch, and she says, "Hi, Dr. Nunnery. We are debating the difference between marijuana and tobacco and their links to cancer. Is there any difference, or are they all the same?" Now, that's an excellent question, and I'm in Texas, and that is a hard question, because some of the data with tobacco use is based on the amount of tobacco concentration over time. For example, the newest guidelines for cigarette smoking is the newest guideline for cigarette smoking is there's a new cancer screening for cigarette smoking, and that new cancer screening shows that if you have more than 30 pack years, that's 1 pack a day for 30 years of cigarette smoking, then that's kind of the guideline of where we're seeing the need for screening with low contrast CAT scan for the lungs. So I haven't found that with marijuana. That is a lot of marijuana. That'd be a lot of marijuana over a long period of time. So that is an excellent question. I haven't seen any data linking quantities or amounts of marijuana smoking to cancer. And like I said, I'm thinking scientifically that maybe that's because marijuana, you don't have the same amounts and quantities. So, but that's an excellent question. Okay, any other questions about that? All right, my next thing is that while it's not an acquired or preventable cancer, there are some conditions called hereditary cancer syndrome. And with hereditary cancer syndrome, there's a way to screen for that in our office. If any of you guys out there are my patients, you have seen, like, I hand out a sheet. It's a pink sheet, and what we do is we have you comb, C-O-M-B, you comb your family history. So we actually take a separate family history besides your regular physical family history. We take an extra family history of just cancer family history. And there are some types of cancers that are genetically linked. And I use COMB, which stands for C-O-M-B, like you're combing your beautiful hair. And C stands for colon, O stands for ovarian, M stands for melanoma, and B stands for breast cancer. So we're looking at colon, ovarian, and we also look at a little bit of endometrial and pancreatic cancer. So when you're looking at combing your family history, there's a genetic test. There are several companies that have genetic testing. Quest has it, Myriad has it. There are other companies that have it, and it's one of the things you guys may have heard of is BRCA testing. That's the BRCA gene that is linked to many of the genetic testing, the genetic cancers. And if you have 2 or 3 family members on the same side of your family with these types of cancers, then there is a blood test. Or it can be just a simple swab of the lining of your cheek. So it's something that can be done simply in your office, in my office, and so give us a call at Click It Clinic if you have any questions about it, or type a question in, and if you have a question, you can make an appointment with us. One of the cool things is that this is National Heart Month, and you've seen a lot of commercials about go get your yearly checkup. Your yearly checkup is very, very important, and there are many things that we can do even virtually in calling you back on your test results, reviewing your genetic testing online. I do that a lot with my patients, so you can give us a call if you have questions about that and set an appointment up with us for that. Chris is asking a question. Miranda just had that test. Oh, yay! She is linked to colon cancer only. So that's very cool. So you'll see that what Chris is saying is her daughter did the test. And if you have the gene that's connected to colon cancer, then one of my patients asked, okay, what's the good of me knowing that I have the gene? Am I going to be scared to death because I've got the gene? What do I do now that I've got this positive test in my hand? And what we do is we recommend earlier and more frequent surveillance. So for colon cancer, there's of course colonoscopy. That's the scope to look in your colon, and we decide based on having that gene, how often and how young you have to start. So, for example, if you have multiple family members with colon cancer in your family and your grandfather was diagnosed at age 50, or your dad was diagnosed at age 50, let's say, with colon cancer, and the usual population screens at 50, you would have to screen 10 years earlier at 40. So, and yes, test ever. Yay! Yes, that is an excellent test. We recommend that. Now I'm in the I'm board certified with the American Board of Family Medicine, and we recommend now asking patients yearly to fill out the form to comb their family history. And so you'll be seeing your family physician as well as your gynecologist asking you these questions. The gynecologists have been doing it for a lot of years, and now primary care, we've been involved in testing and screening our patients. So I'm so happy to have you guys here, and that's kind of all I have for tonight in looking at cancer prevention. And don't forget, the key things tonight are healthy diet, healthy exercise, comb your family history, protect yourself from the sun. I just knew somebody was going to ask me a question about the protection from the sun. The biggest thing on the protection is SPF 15 or above. And even if you're complected, you should still protect your skin. We've got the skin is its own organ in and of itself, and we get one body. That's the other key for tonight. You get one body. It's your one body for life. So if that's all, I'm going to be signing off. Anybody have any other questions? Awesome. I want to thank everybody so much for being here. You guys are totally fantastic. I thank you so much for your support. And you guys keep following us at Click It Clinic. We've got a lot of cool things on board. We have an excellent group of dynamic physicians who are waiting to take your call and take a visit from you and see you virtually. So you guys, thank you so much. Oh, hi, Shelly. Hey, Shelly is the queen of diabetes watching us. Thank you, Shelly. Thank you, Jenna. I appreciate you. And thank you, Chris, and all my Click It Clinic partners. Thank you guys for watching. You guys have a fantastic, wonderful night. And I'll see you later. Good night.